Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about what you do after you've had your ingrown toenails treated. This is a common mistake that people make because they don't know what to do next. So they went and got their ingrown toenails treated, whether it was temporary or permanent, whether it's surgical or whatever. The next question is, what do you do about it? Let me tell you a story first. My son was actually serving as a missionary for the Church of Jesus Christ of Latter-day Saints in Austria. And while he was there, he was actually being treated for an ingrown toenail, and they took him into the operating room, which is overkill. They took him in the operating room and they treated his ingrown toenail and put him in a cast and had him just keep the cast on for a week. Didn't allow him to walk on it, didn't allow him to function, and had him in a cast. That is significant overreach, significant overtreatment, and truthfully reduces the speed of healing and so forth because of some big mistakes that were made. Now, as a father that treats ingrown toenails on a regular basis, you can imagine how that felt. It would have been better for me to spend the money to fly to Austria and treat his ingrown toenail and help him get recovered quicker and to allow him to go through this process. So what I want to do for you is I want to help you skip that, whether I treat your ingrown toenail or somebody else treats your ingrown toenail. I want you to skip that process of not knowing how to recover or being put in a situation where the recovery is not done in the right way. So there are some key pieces to this. If the ingrown toenail is removed, most of the time you do not, one, require antibiotics. You shouldn't need antibiotics if you treat the ingrown toenail. Most of the time the inflammation, the infection, and so forth is because you have what the body considers a foreign body. So the nail that's supposed to be on the outside is actually on the inside, and the body treats it like a sliver, and it's trying to push it out. So if you remove that piece of nail, that allows it to recover, that allows it to get better. So number one, most of the time you do not require an antibiotic. Excuse me. Number two is, what are some options to help it recover quickly? There are really two ways that we found that actually allow it to recover as quickly as possible. One is something that's been used for years and years and years, and that is to soak the foot in warm water and Epsom salt for 10 to 15 minutes, at least twice a day. You could do it 3 times a day. More than that's overkill and it's not going to make a huge difference, but soaking it twice a day, warm water and Epsom salt, to allow it to recover. What that does is that allows the water, because it's got a higher salinity level than your body, to draw any infection out, to allow it to drain, and to help to stimulate it to heal, to allow it to recover. This works. It's been done for years and years and years. We've gotten really good results with it. But the second one is what I'd really like to talk to you about. There is another way to treat this where you actually don't necessarily need to soak it. You can soak it, but you don't necessarily need to. But instead, you're cleaning it like normal. So you get in the shower or whatever, and you clean the foot, and then you apply a special healing ointment that we found. See if I can get it in the picture so you can actually see it. It's called the Essential Healing Salve, and it actually works phenomenally well to allow the area to heal. So it stimulates healing and speeds up the process. It keeps the moisture that you need for it to heal, but doesn't allow it to be so moist that it's causing problems. But the advantage of this, you put it on once a day in the Band-Aid after washing it, and you don't have to think about it again. And it cuts the healing time from the typical 4 weeks that it takes with soaking to 2 weeks, because it cuts down pretty significantly because of those products that are in it that allow it to heal more quickly. There are other healing products. I mean, if you start looking, you can say, okay, I'm going to use colloidal silver on this. I'm going to use honey, medical honey. I'm going to use Amerigel, which is actually one that works pretty well, that also helps speed up the healing some. Or I'm just going to use straight Neosporin or bacitracin on this to allow it to heal, or even Silvadine on this to allow it to heal. So the idea, all of these products are designed to stimulate healing. The Essential Healing Salve is the one we use now because we found that it cuts the healing time in half and speeds up the healing. So the point is, you can soak it twice a day, warm water and Epsom salt, or you can treat it with a healing salve of some sort to stimulate healing and allow it to get better. And the idea, because of those two treatments, most of the time, you do not need an antibiotic. So the last thing I want to talk to you about is what should you expect when it's healing? The idea is the redness, swelling, and pain should be decreasing over the period of time as it's getting better. If you find that the redness is getting worse, the pain is increasing, or it's not healing, then it is probably a good idea to be seen again and say, okay, what's going on? You may need an antibiotic. A small percentage of people do, where that just doesn't heal as quickly as you want it to, so you do the antibiotic to speed up the process. You may actually be doing the exact opposite, where the body's healing too quickly and it's closing off that space underneath the or right next to the nail and not allowing it to drain out the rest of the way like it needs to. And that can also cause significant pain. So what are you watching for? Increased redness, increased swelling, increased pain. All of those are signs that you should be evaluated to say, okay, what do I need to do to make sure this heals correctly? And if you get out there and say, okay, I'm going out 3 weeks, 4 weeks, 5 weeks, and it's still painful, still swollen, and I've already treated it with antibiotics and so forth, what's the other options? There's a possibility that you may have a little piece of nail. Sometimes what happens is you get the nail cut like it's supposed to, but it has a little spicule or a little piece of nail sticking out that's irritating the skin still. And sometimes if you just clip that off or have someone else clip it off, you can actually treat it. So again, this is Dr. Brandt Gibson. If you've had an ingrown toenail and it's been treated, what should you expect? It should be getting better from day one and getting better each and every day as you go. If it gets more red, swollen, or painful, you should be seen again. And there are multiple ways to treat it, everything from soaking it warm water and Epsom salt twice a day to using a special healing salve or something like that on it and a Band-Aid. The goal here is to get you back to normal life without pain and allow you to continue to function. This is Dr. Brandt Gibson. Have a great night. Oh, technically, I should tell you, this is Podiatry Tips Day 215. Now you can have a great